Now, all too often, terminally ill patients feel that they are passed from pillar to post when it comes to getting the right advice and support when they need them. For the past 2 years in Liverpool, they've been running a pilot scheme to try to improve things, and it's been credited with reducing the number of accident and emergency visits that terminally ill patients make. And so, as our health correspondent Jill Dummigan explains, now there are plans to expand it.
Simple pleasures like reading have become increasingly precious to Rosie Carter. She has breast cancer which has spread to her bones and liver. She's often tired and in pain, and this summer it all became much worse.
I became very weak, and also I developed new pain in a different part of my body, and the pain wasn't controlled by the painkillers that I had.
On 3 occasions, Rosie was sent to A&E, but this wasn't a medical emergency and they couldn't help her. Eventually, her situation reached crisis point.
I found it a struggle to do most things, fix myself something to eat, fix myself a drink. These were difficult tasks. I was holding onto furniture, walking around the house because I felt so weak. I was struggling. I was needing help, and I wasn't really getting it.
People like Rosie are already in a difficult, stressful situation, and they don't need the added stress of trying to work out how to access the care they need. And so the hospitals, community care and palliative care services in Liverpool have all come together in a one-stop shop, accessible with a single phone call. This hospice houses one of the city's 2 call centres for the IMPaCT service.
By ringing that number, they speak to somebody who is an expert in palliative care and understands the system. So they're able to assess what the issues are for that person at that moment in time and direct them to either access a particular service or arrange for somebody to see them.
A study of the Liverpool pilot found it reduced A&E visits from people in the last months of life by 44%.
So we can assess the symptoms, but district nurses can also assess for the urgency of equipment as well, if that's what's needed, along with packages of care and so on.
Within hours of calling IMPaCT, Rosie got a medical bed, a walking frame, and 2 days later she was getting respite hospice care.
It was such a relief because they were addressing the problems that I had. They were like targeting in. Words can't describe how reassuring it is. It's the difference between day and night. It's great.
Plans are now being made to roll the scheme out elsewhere. Jill Dummigan, BBC North West Tonight, Liverpool.
I wish Rosie all the best, of course. Now,